Dear student, today's topic is histology of adrenal gland. Adrenal glands are paired structures situated on the upper pole of kidneys. The weight is approximately 5 to 8 grams and each gland consists of peripheral region, the cortex, which is 90% of total weight, and central region, the medulla. Cortex produces steroid hormones and medulla produces catecholamines, that is epinephrine and norepinephrine. In the picture you can see the cortex and the medulla. Coming to the development, adrenal cortex and medulla are structurally, functionally and developmentally distinct, become united during development. Cortex develops from mesoderm, while medulla arises from neural crest cells along with the sympathetic nervous system. Cells of medulla are considered to be modified postganglionic sympathetic neurons which lose their processes and become secretory cells. In this picture you can see the medulla, which is the modified postganglionic sympathetic system part. Coming to the cortex of the adrenal gland first, that is, cortex of adrenal gland consists of three layers from superficial to deep. These are zona glomerulosa, zona fasciculata and zona reticularis. You can see in the picture just below the capsule zona glomerulosa is there, then the zona fasciculata and next zona reticularis, and beneath the zona reticularis adrenal medulla is there. Out of these three cortical layers you can see the thickest one is the zona fasciculata. Cells of cortex show characteristic feature of steroid secreting cells, that is, have lipid droplets, many mitochondria and smooth endoplasmic reticulum. Coming to the superficial most cortical layer of adrenal gland, it constitutes outer 1/5 of cortex and formed by rounded or arched clusters of columnar or pyramidal cells. Hence, the layer is termed as glomerulosa. In this picture, the red mark area, you can see the rounded or arched cluster of cells, the zona glomerulosa layers. The cells have few lipid droplets. Fenestrated capillaries are found among the cluster of cells. Zona glomerulosa secretes mineralocorticoid, that is the aldosterone, which involved in maintenance of water and electrolyte balance of body, and this is done by stimulating the reabsorption of sodium in distal convoluted tubule of kidney in exchange of excretion of potassium. Secretion of aldosterone is regulated by the renin-angiotensin system. Coming to applied anatomy related with the zona glomerulosa layer, Addison's disease, where there is deficiency of mineralocorticoid secretion, the clinical features are increased skin pigmentation, muscular weakness, weight loss, and hypotension. Cone syndrome, where there is adrenal hyperplasia with excessive mineralocorticoid secretion. As a result, there is hypertension and hypokalemia. Second most layer, that is the zona fasciculata. It is the thickest layer, that is 3/5 thick, present in the middle of the cortex and formed by straight parallel cords or columns or fascicles of polyhedral cells. Hence the term fasciculata is used. Fenestrated capillaries are found between the cords of cells. In this picture you can see the red mark area, that is the zona fasciculata. The cells, polyhedral cells, they are arranged in the parallel columns or fascicles. Cytoplasm of the cells of zona fasciculata contains many lipid droplets. Lipids are extracted during histological procedure. As a result, the cells give vacuolated or spongy appearance. That is why zona fasciculata cells are also called spongiocytes. These cells also contain considerable amount of vitamin C. Zona fasciculata secretes glucocorticoids, mainly cortisol, and this secretion is controlled by pituitary secretion, that is the adrenocorticotropic hormone. Glucocorticoids regulates protein, carbohydrate and fat metabolism. Glucocorticoids also cause synthesis of glucose, that is the gluconeogenesis. Glucocorticoids cause breakdown of lipid into free fatty acids. It also increases protein breakdown. Glucocorticoids suppress immune, inflammatory and allergic response. Coming to clinical correlation related with the secretion of zona fasciculata, Cushing syndrome, and it occurs due to adrenal hyperplasia with excessive secretion of glucocorticoids, causes truncal obesity, hypertension and hirsutism in female due to pituitary adenoma that results in excessive production of adrenocorticotropic hormone. Coming to third layer of the adrenal cortex, that is the zona reticularis. It is the innermost layer composed of irregular anastomosing cords of cells form a reticulum. That is why reticularis word is used. The cells of cytoplasm contains lipofuscin pigments and few lipid droplets. You can see the red mark area, the zona reticularis. Zona reticularis secretes small amount of androgen and estrogen. These sex hormones are of little physiological significance. Zona reticularis secretion is under control of pituitary gland. Coming to the clinical correlation related with the secretion of zona reticularis, adrenogenital syndrome, excessive secretion of adrenal androgens from the zona reticularis. As a result, there will be masculinization of females and precocious puberty in males. Adrenal cortex is essential for life. Its removal leads to death unless the hormones produced by it are supplied artificially. Coming to medulla of the adrenal gland. Medulla of the adrenal gland made up of columnar or polyhedral cells arranged in groups or short cords. Cells secrete noradrenaline, that is the norepinephrine, and adrenaline, that is the epinephrine, into the blood. In this picture, you can see the red mark area, medulla portion of the adrenal gland. Cells of medulla stored their secretion in granules. With electron microscope, cells of adrenal medulla show rough endoplasmic reticulum. This is unlike of the cortical cells of the adrenal gland, which contains mainly the smooth endoplasmic reticulum. Secretory vesicles contain secretions. You can see the medulla consists of rough endoplasmic reticulum and secretory granules. Chromaffin reaction. Medulla, when fixed in potassium dichromate solution, oxidation of catecholamines occur. As a result, medullary cells show yellow granules in their cytoplasm, and this reaction is called the chromaffin reaction. Cells giving positive reaction are called chromaffin cells. The adrenal cortex cells do not give these chromaffin reaction. Functionally, medullary cells regarded as modified postganglionic sympathetic neurons, which lose their axons and dendrites to become secretory cells. Like typical postganglionic sympathetic neurons, they secrete noradrenaline and adrenaline in response to emotional stress, that is fight or flight situation, and results in widespread effects similar to those of stimulation of sympathetic nervous system, that is increase in heart rate and blood pressure. Secretion of medulla thus is under nervous control. Epinephrine and norepinephrine are secreted by two different types of medullary cells. Epinephrine secreting cells have small, less electron dense granules, while norepinephrine secreting cells have more electron dense granules. In contrast to suprarenal cortex, the medulla is not essential for life, as its function can be performed by other chromaffin tissues, that is paraganglia, example para-aortic bodies and carotid bodies. Relationship of adrenal medulla with autonomic nervous system. Adrenal medulla is considered as extension of autonomic nervous system. Both adrenal medulla cells and neurons of sympathetic ganglion are derived from neural crest cells. Both are innervated by preganglionic sympathetic nerve fibers, and both produce catecholamines. Coming to blood supply of adrenal gland, the capsule of adrenal glands contains the arterioles and arteries. From these arteries, the cortical arteriole break into capillaries and then drain into medullary vein, while the medullary arteriole directly go from capsule to medulla and then break into capillaries and drain into the medullary vein. In this picture, you can see the capsular arteries, which is present just beneath the capsule of adrenal gland, and then two types of arteries arise. One is cortical arteriole and another is medullary arteriole. Cortical arteriole divides into capillaries and then drain to the medullary vein, while the medullary arteriole pass through the capsule without dividing into arterioles, come to the medulla part, then divided into many capillaries and then drain into the medullary vein. Thus, medulla has dual blood supply from cortical capillaries and from medullary capillaries. This is a chart showing the secretion of different parts of cortex and medulla of the adrenal gland, their function and their control. Pheochromocytoma, tumor of the medulla, periodically secrete high levels of catecholamines, and this is life-threatening, where there will be transient hypertension with cardiac arrhythmias. Lastly, you can see in the disorders of adrenal cortex, when there is hyperadrenalism, hyperfunction, then two conditions may occur: Cushing syndrome due to increased glucocorticoid and Conn's syndrome due to increased aldosterone. And another is the hypoadrenalism, that is hypofunction. There will be Addison's disease where there is decreased secretion of the glucocorticoid.